I'm Dr. Joseph Ashburn. I'm the Medical Director of Stroke here at Western Baptist Hospital. So stroke is the third leading cause of death nationally currently. In addition to that, it's the leading cause of disability nationally. Unfortunately, it's also one of the least publicized of all the major cardiovascular disease. Some of the most easy ways to remember stroke is in the acronym FAST, F standing for face, A standing for arm, S standing for speech, and T standing for time. Of the four of those, probably the most important is T for time. After the stroke occurs, each minute is critical, and each minute that you delay, more brain cells die. So the quicker you can get to a certified stroke center, the quicker we can deliver TPA. TPA is the clot-busting medicine we use to reverse or at least improve the signs of stroke. While each minute is important, we can give this miracle drug, as it's sometimes called, up to 3 hours time after the stroke has occurred. But a stroke center doesn't stop there. Even in patients who aren't eligible for TPA, we can often bring them into the hospital and find the reason they had the stroke. While we can't always reverse the symptoms, we can identify correctable risk factors. And when we find these, we can attempt to reverse them to lower the risk of having a secondary stroke. Yeah, so the incidence in the area of stroke is actually quite higher than the rest of the nation. Quite some time ago, there was a stroke belt identified in the southern portions of the United States, and Kentucky borders on that stroke belt. So compared to other parts of the nation, the incidence of stroke is quite higher here. Unfortunately, in that same stroke belt, the number of stroke centers is actually quite small. And so here at Western Baptist, we're very proud that we have the only stroke center. So there are probably two different things we look at in strokes. One is correctable causes of strokes, and others are non-correctable causes of strokes. So there's some things you can't change. So for instance, your genetic makeup. If your mom, your dad, your grandparents had stroke, then you're at increased risk for stroke, and there's nothing you can do about that. But there are correctable causes of stroke as well. Maybe lifestyle changes that we can make to help reduce the risk of stroke. Those would include tobacco use. You can reduce hypertension. We can look at cholesterol and lipids. There are surgical surgeries that can be done to help reduce the risk of stroke for people who have internal carotid artery disease or common carotid artery disease. We can do carotid endarterectomies, and that reduces the risk of stroke. Smoking cessation is another thing that we can do to help lower the risk of stroke. So one of the best things we can do is primary prevention of stroke. People who haven't had strokes, but we can identify correctable risk factors and correct them before they have that stroke. So health fairs like today that identify those correctable causes of stroke are fantastic. We can do things like monitoring blood pressure, listening to people's neck to see if they have carotid bruits, and that identifies carotid disease, which are a known risk factor for stroke. We can test cholesterol and blood sugar. Things like diabetes greatly increase your chance of stroke. We can talk about tobacco use and cessation of tobacco use. And these correctable factors are important to identify, not only in people who haven't had strokes, but even in people who have had strokes, to monitor them closely to make sure there's nothing more we can do to prevent that second stroke from happening.